All right, being in the emergency room can be a frightening and overwhelming experience for anyone, but that's especially true for people living with dementia.
Right, there's so much there to balance, and a new study from U of M Health finds that older adults with dementia are frequent visitors to the ER. Our own ER doctor, Frank George, is here to talk with us tonight exactly about why that is happening and also the challenges it can pose for them and for doctors.
Well, exactly, Karen and Damon. You know, one of the biggest challenges with patients suffering from dementia is that as the disease progresses, it can be difficult for them to communicate to us what they're experiencing. Often we have to rely on caregivers for that information. And one of the most common reasons that we see people with dementia in the ER is for behavioral or mental health concerns.
While we often think of dementia as a cognitive or memory disorder, it's often these behavioral aspects of the disease that can be most distressing for patients and their care partners.
Those can include a wide range of problems, says Dr. Lauren Gerlach, a geriatric psychiatrist at University of Michigan Health.
These types of symptoms can include things like agitation or aggression, things like hitting or kicking, unrelenting anxiety, or what we call psychosis, which can include things like distressing hallucinations or paranoia.
Gerlach and her research team found older adults living with Alzheimer's disease and other forms of dementia visit the ER 1.4 million times a year. That's nearly 7% of all emergency visits for any reason by people over 65. They also found patients with dementia were twice as likely to receive antipsychotic or sedative medications compared to older patients without dementia.
That can be concerning because these medications are associated with a high risk of side effects. They can lead to falls, which then can lead to future emergency department visits if they're continued.
Gerlach says the study suggests there's a lot of opportunity to prevent ER visits by better supporting dementia caregivers.
I often guide my patients and families to the Alzheimer's Association, which has wonderful caregiver training resources, as well as support groups and 24/7 hotlines to help caregivers who might be struggling managing these behaviors at home.
Now, some of the potential triggers for these behavioral challenges include an underlying medical illness, a new medication, changes in their home environment, untreated pain, or even something as simple as constipation. Identifying that trigger can really help resolve the behavior, but it often takes some work to uncover what's really going on.
Gosh, there's so many layers to that.
There sure are.
Thank you, Doc.
Good information for an issue that affects so many people.
Definitely.